Excellencies, distinguished delegates, I'm honored to represent UNFPA, the United Nations Sexual and Reproductive Health Agency, at the World Health Assembly 75th General Debate on the critical topic of health for peace, peace for health. UNFPA's strategic plan for 2022 to 25 prioritizes the rights, health, and well-being of women, men, girls, and boys in all their diversity. The strategic plan aims to accelerate the achievement of 3 transformative results: 0 maternal death, 0 unmet need for family planning, and 0 gender-based violence and harmful practices by 2030. The world faces important and renewed challenges in meeting these results, and to achieve them and the broader 2030 agenda, working through the triple development, humanitarian, and peace nexus is key. In that light, allow me to congratulate WHO for its groundbreaking initiative on health and peace. It's high time we turn our collective attention to these issues. Violent conflict has a profound negative impact on health outcomes for women, adolescent girls, newborns, children, and other groups typically discriminated against and stigmatized, including LGBTQI persons. It also has a negative impact on other sexual and reproductive health outcomes that disproportionately affect women and adolescent girls, such as maternal mortality and morbidity. Conflict adversely affects health systems and undermines the quality, coverage, and availability of health services, including reproductive, maternal, newborn child, and adolescent health services. Conflict can heighten women and girls' risks and vulnerabilities to sexual violence, exploitation and trafficking, child marriage, intimate partner violence, and other violations of their rights. These risks tend to remain high post-conflict, and in turn this forms a continuum of gender-based violence before, during, and after conflict, with far-reaching consequences for women and girls and health and well-being, as well as for development and recovery prospects. The mental health consequences of conflict are serious. Survivors can suffer from long-lasting challenges to their physical and psychological health and well-being. This is why WHO's Global Health for Peace initiative is so critical. It brings all the critical issues to light and can trigger important shifts in how health interventions are prioritized in the field of peace building. And like many of our sister agencies, encouraged by the 2016 Sustaining Peace resolutions, we at UNFPA have worked on deepening our contributions to peace in the past several years. Right now, working with Interpeace, we are reviewing our programmatic interventions in several countries to assess how our sexual and reproductive health and gender equality interventions contribute to peace. This includes interventions in Myanmar, the Gambia, and the Philippines, among others. We need further research and data to enhance the work on health and peace. Health resilient systems must be peace-promoting and responsive systems. We need new capacities to implement dedicated programs, and we need updated competencies to deliver integrated peace-responsive programs. And we need Member States' high-level support to prioritize these issues within their own health policies. We also need Member States' commitment towards securing and enabling a safe civic space which takes into account the voices of affected communities, women and youth peace builders, and youth-led organizations. You can count on UNFPA to play its parts as we count on you to support this important work. Thank you.